evening and welcome to another interesting package of the program, Easy Access to Healthcare for All, bringing you news and happenings around the National Health Insurance Authority and the health insurance space as it fulfills its mandates to Nigerians. I am Aisha Muhammad Ahmed, your anchor on the program. To help it achieve its mandate, the NHIA has decentralized its activities to the state. One of such offices is the FCT office, which is located in the heart of Abuja and functions like any other state office under the NHIA arrangement. Let us look at the role and operations of the FCT office as we bring you an interview with Barrister Greg Azubuike, the FCT Coordinator. Please stay tuned.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. Top on the news, NHIA mounts sensitization program for top management staff as it holds a 3-day meeting for the development of a health insurance information management system. These and more stories coming shortly.
A media luminary, you are a grandmaster.
In order to promote transparency and accountability in the operations of the NHIA, the management of the National Health Insurance Authority, on Wednesday, 2nd November 2022, organized a one-day sensitization workshop on anti-corruption for its top management committee. The exercise was conducted by the Independent Corrupt Practices and Other Related Offences Commission, ICPC, and it explored the issues of document security, ethics, and whistleblowing.
Transparency and accountability.
Speaking at the event, the Director General, Professor Mohamed Nasser Sambo, said the workshop is in line with the NHIA mandate. He explained further.
Right from the day I stepped into the office, I ensure that engendering transparency and accountability is one of the key things that we must pursue. And while I was doing a review of documents that has happened in the National Health Insurance organization scheme, then I realized that there was a system study for NHIA, I think in 2018. The report of that system study was very damning. In fact, there were about almost 20 queries. I sat down with my team in finance to review those things. I say, as a chief executive officer, I will not allow myself to see or to fall into that trap of these queries. I have been able to survive it. I don't think I will be able to survive it. So we study the system review, and we bring out all the key issues that we need to look at, so that in the event of another system review, there will be, even if we are not getting 100%, but we will make a significant progress.
Mr. Ayo Osinlu, the General Manager, Special Duties of the NHIA, while giving the opening remarks, said the workshop was to remind participants about integrity and accountability as they carry out their duties.
Particularly with reference to the integrity of justice, as well as, of course, how those principles impact upon transparency and accountability. We are well aware that the privilege of our positions fundamentally is public trust. It is public trust in our custody. It means, therefore, that we are under the burden to discharge ourselves equitably in that context in the first place, and then two, to also be able to conduct our businesses and schedules in a way that uphold public trust.
Barrister Abai Odufai and his team from the ICPC facilitated the workshop. Speaking in an interview, Barrister Odufai gave his expectations of the NHIA.
We spoke on three main subjects: the ethics and integrity compliance scorecard, system studies and review, and whistle-blowing policy. These three areas are very crucial to ensuring transparency and integrity in agencies. So we expect that after this program, the NHIS will improve on their systems, improve on their policies and practices, so that we expect them to be higher in the scorecard we deploy annually. We expect that staff will not fall into the bad side of our expectation, and that like the MD said, the director mentioned, they have improved tremendously in the scorecard, improved their systems, and we expect them to continue doing this as we go along.
Participants speak on the impact of the workshop.
I think it is very enlightening, and since it captures heads of departments in the scheme, in the authority, it will be easier for whatever has been learnt here to cascade down to staff at the lower rungs in the organization.
It's an eye-opener. It has given us perspectives of how the organization has been actually transparent in its dealings, so it's giving us more perspective of what to do.
Except, of course, if you were in NHIA before.
The National Health Insurance Authority, NHIA, has organized a 3-day meeting on the development of a health insurance management information system. Participants were drawn from stakeholders across the health sector.
Okay, which has bring about.
Speaking at the event, Professor Mohammed Nasir Sambo said working with evidence is a part of rebranding agenda of the NHIA, and that can only be achieved through a health insurance management information system that will help the NHIA make informed decisions.
It is now time that we need to sit down and see what data can we generate, how can this data be transmitted within the ecosystem, and where is the final destination of the data, what are the various yardsticks at every level that we can sieve out and analyze and take a very informed decision. So I want to seize this opportunity to welcome you all for this very, very important engagement. This is one of the most important engagement that we are going to do in the health insurance. And this is one of the very important activity that will bring about the integration of the ecosystem of the health insurance. Because every subsector in the National Health Insurance Scheme is expected to transmit certain kind of data that can be aggregated at the top for decision making.
General Manager, Planning and Research of the NHIA, Haji Asma'u Mohammed, while making the opening remarks, said there is a need to have a reservoir of data, and therefore the meeting was crucial and timely, as the NHIA is set to launch its eNHIA platform.
Health insurance is being stepped up. There is the need to have a reservoir of data which can be drawn from, processed, analyzed, interpreted, disseminated, and used to establish trends, make projections, and improve the health system. Another visionary reform of the DG has been to set up the eNHIA project in between the health insurance stakeholders. The eNHIA will support interconnectivity, data transmission, security and analytics information for evidence-based decision-making. This discussion on the health insurance management information system is indeed timely, especially at this time that the NHIA is setting up the eNHIA, which will soon be launched.
Resource person from the World Health Organization, Dr. Francis Ukweje, speaks on the essence of the meeting.
This workshop seeks to do is to ensure that we have appropriate health insurance management information system. So to be able to track the results of what we do in the country in terms of financial risk protection. If we don't have a mechanism, a system, a robust system to be able to monitor, to evaluate and track the progress, then it's as good as not doing it at all.
The program is easy access to healthcare for all, bringing you news and issues around the National Health Insurance Authority. The National Health Insurance Authority has a mandate to, amongst other things, get Nigerians covered by health insurance. It makes this work by ensuring that it is represented in the states. In addition to this, it is working tirelessly with state health insurance agencies to see that universal health coverage is achieved. In our next segment, we will see the level of health insurance coverage in the Federal Capital Territory as we speak to Barrister Greg Azubuike, who is the NHIA FCT Coordinator. We shall also get to hear from the CEO of the FCT Health Insurance Agency, Dr. Ahmed Damfulani, on the strides the agency is also making towards the same goal of universal health coverage.
The decentralization to states is one of the major moves the Professor Sambo's administration is deploying to ensure that Nigerians everywhere are covered by health insurance. Barrister Greg Azubuike is the coordinator of the NHIA FCT office. He gives us a rundown of health insurance coverage in the FCT.
FCT, being a city of government, is essentially populated by civil servants, public servants, federal government public servants in particular. And knowing that health insurance in Nigeria kicked off with the formal sector, or what you may call public sector, I think I can say without fear of contradiction that our activities here in FCT has actually permeated the society, the populace. Reason being that most of the people resident here are public servants. And by virtue of being employed to the federal government MDAs, automatically, more or less, you enroll into NHIA programs.
A major function of the FCT office is to check the operations of health facilities within the Federal Capital Territory. This is to ensure that enrollees under the NHIS schemes get premium treatment.
We have what we call an SQA department, Standard Quality Assurance Department, whose duty it is to make sure the standards we set for the HCPs, or what we call the hospitals, actually are maintained. So we have regular checks, we have what we call quarterly checks, we have on-the-spot checks, we also have checks we do based on complaints from enrollees. Yeah, there are well over, I think we have the highest in the Federation actually of accredited facilities. FCT actually has the highest. We have well over 500 facilities in the FCT and a couple of thousands of services accredited in the FCT. Yeah. So what we do to ensure they have, they maintain the standard is that we make sure we visit them. Every facility at least once a quarter. We visit them, and I think our SQA department here in the FCT office is really doing very well, and we've received accolades both from the enrollees and in fact from our head office. Yeah.
Most enrollees under the NHIA are civil servants in the formal sector. This excludes a number of persons in the informal sector who cannot be left behind in the march towards universal health coverage. Barrister Greg speaks on efforts put in place to capture the informal sector.
We have what we call sensitization activities, which we carry out in the various areas. For instance, what was it? Sometime 2 weeks ago, my staff were there to sensitize the bureau de change. These people that sell dollars, naira, and other stuff, the bureau de change. We had a sensitization activity with them, and they promised to come and enroll en bloc. We also went to Kugbo Market. There's one furniture mechanic workshop and the furniture this in somewhere Kugbo along Nyanyar Express Road. We've been there twice. They have also given us assurances they want to enroll all their members. In fact, the other day, we got a letter from one Catholic church somewhere in Lugbe that we should come and sensitize them. In fact, on that Sunday, I sent 2 of my staff who went there and sensitized them. They've also written back to us that they are coming to enroll. In fact, every day we sensitize people, and most of the time, we have commitments from them that they will enroll.
Working towards universal health coverage alongside the NHIA FCT office is the FCT Health Insurance Scheme.
The FCT Health Insurance Scheme has been on board for more than 14 years now, doing the business of health insurance. Basically, we focused on the formal sector, whereby all the staff of FCT, they are all under the scheme, 100%. Anyone that's not on the scheme is the one that has not come to the agency to come and register. Otherwise, everybody is 100% covered. And recently, too, we have been able to cover all the area council staff, except a few of the AMAC staff. So the formal sector program in FCT is highly successful.
With the decentralization of the NHIA operations and the health insurance under one roof, the NHIA and the FCT Health Insurance collaborates to achieve their common goal.
We have a lot of collaboration, most especially with the introduction of the Basic Care Provision Fund. So because this program is a federal government program and is domiciled in NHIA, so a lot of the aspects of this program is being coordinated by them. So more often than not, we are doing this program together. While we are implementing, they are also regulating. And so it's a very good collaborative effort.
The NHIA is working assiduously to ensure quality service delivery to enrollees when they visit their facilities. Barrister Greg, share with us some of the problems encountered when they visit the facilities and how it is resolved.
The major one I must tell you is this OS syndrome, out of stock syndrome. That's the major complaint we get. People go to hospital, well, drugs are prescribed, they go to pharmacy to collect their drugs, they are told no drugs. But management, in its wisdom, is aware of this, of course, and in its wisdom is working very hard to stop that.
Welcome back. Today on our Stakeholders segment, we'll be bringing you an interview with Celine Emmanuel, Head, Human Resource, BioRoyal Hospital and Maternity, located in the city of Abuja, Nigeria. BioRoyal is one out of the many healthcare facilities accredited to give care to enrollees of the NHIA. She gives us a brief on their operations and services rendered.
We provide primary health care to the NHIS clientele, and we've been doing that since 2006, thereabouts, before I even took this role. And so far we've had over like 500 enrollees under this scheme. BioRoyal has been providing primary care basically to them when it comes to, anything more than what we can offer or what we've signed up to offer. We then refer to other facilities that are equipped to do that.
Celine Emmanuel says the healthcare system in Nigeria is good, but can be improved upon.
So far, so good. It's been a journey. Nigeria, the healthcare system has been evolving, with new trends, new innovations into the healthcare system, and changes and evolving factors have really improved the system, and we are not there yet, but we hope that we will do better each passing time.
She describes the introduction of NHIA as timely, but thinks the implementation can be better.
The idea of its encouraging healthcare service assessments, at the grassroots is really commendable. But the reality on ground is that you still see the gaps in the grassroots. There's still that gap that needs to be filled in. I don't know how we'll really close the gaps, but then a lot of work needs to be done. And accessibility in terms of as a provider, there's quite a number of people that have been assessing it, and assessing healthcare using the platform, and most of them, I would say, are really government workers or public servants, not necessarily the grassroots as hoped.
Celine has some suggestions to make that will help improve coverage within the NHIA.
First and foremost, we're talking about the grassroots. We do understand that the grassroots, we are talking about people that really can afford this care. I know a lot is going on in terms of reaching out to them. We talk about people in rural areas, and how do they access care if they can't fund it, because insurance is a business too. So how we have to think through the lines. So I, for one, think a lot needs to be done at that level, because when you go for outreach programs, you talk about these things, they are, in short, it's strange to them. I don't think orientation needs to be done a lot in that area.
That was Celine Emmanuel, Head Human Resource, BioRoyal Hospital and Maternity, located in the Federal Capital Territory, sharing her perspective on issues surrounding the NHIA operations. Coming up next, your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Are children covered under NHIS?
If you look at the way the NHI is structured, what we call the formal sector program, the public sector program, if a principal who is like the worker gets enrolled, who's the spouse, the children biological children under that principal, 4 of them under the age of 18 years, covered under the program until they get to the age of 18, when they can now join other programs to continue.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this episode of the program. If you have questions or comments, please send them through any of our contact mediums on your screen. You can also watch the program anytime, any day via our YouTube channel. Join me again, same time, same station, for another episode as we continue to bring you more stories of happenings around the NHIA. See you next week.